How are you going to keep provinces accountable when it comes to how they spend healthcare dollars?
This is something we're actually approaching based on the success of our childcare deals. We knew that different provinces across the country had very different approaches to delivering childcare in their country, in their regions, and therefore how the federal government would make sure that we were investing to support citizens and families across the country in a fair and reasonable way involved negotiating directly with different jurisdictions according to their requirements. Now, we set out clear metrics. We needed to see half price reduction in childcare fees in the first year, getting to $10 a day childcare within 5 years. How they worked on that, how many spaces they added to, how they were going to ensure that we're properly paying early childhood educators, those were all things that we negotiated bilaterally, and they are going to be held to the number of spaces they committed to obtaining or creating in that time. That is what we approached on childcare. We have a similar approach on healthcare, understanding that different provinces have different levels of access, for example, to primary care physicians already, different abilities to deliver mental health care, different data systems or different levels of sophistication in their data. So what we are going to do the work right now with provinces on is sitting down with them and saying, okay, what is your target for access to primary care physicians? Do you want to get to 95% of your residents with primary care physicians? Are you going to be satisfied with 90 or even just 75? Depending on where you are right now, what are you going to set as your priority, and how much of this money that we're putting forward are you going to invest in that? They get to generate that target. If they choose to get 75%, they will have to explain to their citizens why they're accepting that a quarter of their citizens won't have access to primary care. But we're looking for ambitious targets that are reasonable for them, that they can hit, that they can be accountable to, that will improve access to primary care in a significant way. Similarly across the board, with the exception of data. For data, we need to make sure that people are developing sophisticated data systems that allow them to empower their health community to have the proper information on all the patients they're treating and be comparable and give us a national picture of how health is doing in Canada with clear outcomes and numbers. Those are things that we're going to be rolling up our sleeves to deliver, but the targets and the metrics will be negotiated together, province by province. That's why we're embarking on 13 different negotiations now, not just one, but that's the way to make sure that at the end of the day, all Canadians get access to the best quality healthcare.